Today, we're diving into the Hartman procedure. It's a surgical technique often used in emergency situations involving the colon. We'll explore when it's applied, how it works, and why it remains an important option in complex cases. Let's get started. Let's talk about the Hartman procedure, a surgery often done in emergencies involving the colon. The surgeon removes the diseased segment, usually the sigmoid colon. Then, the lower end of the rectum is closed off but not reconnected right away. The upper end is brought out through the abdominal wall as a colostomy. This operation is commonly done for complicated diverticulitis, colon cancer causing blockage, bowel perforation, severe infections like peritonitis, or trauma to the colon. It's a critical step when immediate repair isn't possible. Let's break down this procedure into simple steps. First, the diseased part is removed, that's the cut. Then, the rectum is closed off. Finally, the colon is brought out to the surface, creating a colostomy. This approach can be life-saving, especially in emergencies, and it avoids reconnecting the bowel right away in patients who aren't stable. But there are downsides. The colostomy can be temporary or permanent, and it usually means a second surgery later to reverse it. Not every patient can have that reversal, though. Let's break down the Hartman reversal with an easy memory trick. Think of it as two parts: first, cutting the stoma during the initial procedure, and now, reconnecting and closing it. The reversal involves taking down the colostomy, reopening the rectal stump, and reconnecting the colon to the rectum. Finally, the abdomen is closed. It's done once the patient has recovered, is stable, and free from infection. Simply put, it's joining back the bowel and closing the stoma to restore normal function. Let's talk about an easy way to remember two key surgical procedures. Hartman's procedure involves cutting and creating a stoma. The reversal, on the other hand, means reconnecting the bowel and closing the stoma. The big advantage here is restoring normal bowel function and getting rid of the colostomy bag. But it's not without risks: leaks, infections, bleeding, adhesions, and sometimes temporary bowel issues. Timing usually falls between 3 to 6 months, depending on how the patient's doing. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. Let's take a clear look at the Hartman procedure and its reversal side by side. In the initial procedure, the diseased part of the colon is removed, and the rectum is closed off, creating a stoma, a temporary stool bag. When it's time for the reversal, the colon is reconnected, the rectal stump is opened and joined, and the stoma is closed. This restores normal bowel passage. This table gives us an easy visual comparison of the two steps and their outcomes. We're looking at coding clinics and navigation, two key ways to support users as they work through complex information. Coding clinics offer targeted help, breaking down tricky parts into manageable steps. Navigation, on the other hand, is about guiding users smoothly from one point to the next, so they never feel lost. Together, these tools create a clearer path, making the whole process easier to follow and less overwhelming. Now, let's talk about Hartman's procedure reversal, sometimes called the Hartman takedown. This is the step where we reconnect the colon after the initial surgery, restoring normal bowel function. It's a critical follow-up that helps patients regain their quality of life. Understanding this procedure is key to seeing the full picture of patient recovery and surgical planning. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. Now, let's focus on ileostomy, how it's formed, revised, repaired, and eventually reversed. We'll explore the key steps involved in creating an ileostomy, what prompts a revision or repair, and the process of takedown when it's time to restore normal bowel function. Understanding these stages helps us appreciate the complexity and care required throughout the patient's journey. Let's talk about ileostomies, what they are, the types, and how they're formed. An ileostomy is a surgery where the last part of the small intestine, called the ileum, is brought out through the abdominal wall to create a stoma. This opening allows waste to exit the body. There are two main types: end ileostomies, which can be permanent or temporary, and loop ileostomies, usually temporary. The procedure involves making an incision, identifying the ileum, bringing it to the surface, creating the stoma, and securing it to the skin. Common reasons for this surgery include ulcerative colitis, Crohn's disease, colorectal cancer, and bowel trauma. Let's talk about ileostomy revision, what it involves and why it's needed. This procedure usually means refashioning the stoma, sometimes making it bigger or moving it to a better spot, and repairing the tissue around it. It's generally less extensive than the initial surgery. Why do we do this? Often, it's to address complications like narrowing, prolapse, retraction, or skin irritation. These issues can make daily life harder, so the revision helps improve comfort and function. Let's talk about the ileostomy takedown, what it is, when it's done, and what to expect. This surgery reconnects the bowel and closes the stoma, restoring normal bowel function. It usually happens after the primary disease has healed, often following a temporary ileostomy from colorectal surgery. While it improves quality of life, there are risks to keep in mind: infection, bleeding, leakage, and bowel obstruction. The procedure involves detaching the ileum from the abdominal wall, reconnecting the bowel ends, and closing the opening. Let's break down the three main procedures we're focusing on. First, formation. This is where we create the stoma. It's the most complex step. Next, revision or repair. Here we correct any stoma issues that come up. It's a bit less complex, but still important. Finally, takedown. This restores bowel continuity by closing the stoma. It's also moderately complex. Remember it like this: formation creates, revision fixes, and takedown closes. Simple and easy to keep in mind. Now, we're looking at ileostomy revision and repair, alongside ileostomy formation. These procedures are critical in managing patients with certain digestive conditions. This part of the presentation also highlights coding clinics and navigation tools, like PATH, that help us accurately document and track these interventions. Understanding these elements ensures better patient care and smoother administrative processes. Let's dive into how these pieces fit together. Now, let's talk about ileostomy takedown, also known as reversal. This is the process where we reconnect the intestines after an ileostomy, restoring normal bowel function. Sometimes, patients need an ileostomy revision or repair instead. That's when adjustments are made to the existing stoma to improve comfort or function. Both procedures focus on improving quality of life by either restoring normal digestion or optimizing the stoma itself. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. Let's wrap up with a simple way to remember the difference between Hartman and ileostomy. Hartman involves surgery to remove diseased colon, followed by creating a colostomy. Ileostomy, on the other hand, diverts waste through a stoma made from the small intestine. So, Hartman means removal plus colostomy, while ileostomy is all about diverting the small intestine. The key differences are in what's removed, the type of stoma, and the complexity of the procedure. Both can be reversed, but Hartman is generally more complex. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. A brief transitional moment here as we move between sections of the presentation. Let's continue forward to the next topic, which we'll explore in more depth. Let's talk about loop ileostomies and their role in surgery. A loop ileostomy is often a protective step when the large intestine is removed and the ends are reconnected. It diverts stool temporarily, giving the colon time to heal. When it's time to close the ileostomy, the procedure involves excising the stoma and reconnecting the intestine. This reconnection, or anastomosis, is part of the surgery and isn't coded separately. The same principles apply to loop colostomy takedowns, with excision as the root operation. In some cases, repair might be used if no tissue is removed. Different types of colostomies, like Hartman's procedure or endoileostomies, serve specific clinical needs, often depending on the underlying disease or emergency situation. Overall, these surgeries help manage various colorectal conditions, with stoma creation and closure carefully coded for accurate reporting. Closing a Hartman procedure is more complex than other stoma takedowns. Because the two bowel ends are separated, surgeons need a more invasive approach, usually laparotomy or laparoscopy. First, both ends are freed up to reach each other, then reconnected, and finally repositioned back inside the abdomen. That's why the root operation reposition fits best here. Sometimes, patients develop a peristomal hernia, which requires a separate repair of the abdominal wall. Coders should carefully review documentation, since not all stoma takedowns use the same coding approach. Thank you for joining me today. I hope this talk sparked some new ideas and inspiration. Remember, every step forward counts, no matter how small. Keep exploring, keep questioning, and keep creating. Until next time, take care and stay curious. This video was created with SlideSpeak. Visit SlideSpeak to turn your presentations into engaging AI-narrated videos.